Welcome back to another episode of the CHW podcast. Welcome, everybody. We have a special treat, you guys, today. Today, we have the Executive Director of the National Association of Community Health Workers, Miss Denise Smith, with us. Thank you so much, Denise. Thank you for joining us.
Thank you, Tasha, and hello to all the CHWs.
I'm really excited to have this conversation, get to know you, get to know goals for the National Association. So let's just jump right on in. So you began to be the National Association Director last year. And so if you could just take us back through a little bit of your journey in your career and how this guided you to become now the National Association Director.
Sure, absolutely. I became the founding ED in November 2019. So I am about 6 months into the role right now. And I want to say that it is a complete honor and quite a charge to take up this role for this organization that has been decades in the making. Were it not for CHWs, my peers, my elders from across the country and allies getting together as thought partners over many decades in many different settings to consider the needs of this workforce, to create the foundations for this workforce, we wouldn't be here today, and I wouldn't be in this role. So I just want to say a special thank you to folks who've been doing the work for decades or who have been allies for decades. So my journey as a CHW really started when I was quite young. I had a mom who was very committed to public health, in particular, a really strong advocate for people living with HIV/AIDS and for prevention, education, screening, and testing and treatment for communities that are impacted. And I grew up, was born in 1970, so I grew up in the early 80s with the Silence Equals Death and a lot of awareness. And my mom made sure that I was going to be an articulate advocate. Not too much more in the future. I had a close person to our family who died of AIDS. And I found myself having to, this person was older, much older, and I found myself having to have conversations across generations and across communities about HIV. And there was, of course, a lot of stigma during that time, and regretfully that continues. But that stayed with me, that there was something that I could do in response to what was happening, that there was a role for me, that my love and compassion and my desire could translate into action and communication and education. My first life, this is what I often tell people, I was a theater artist. I went to IU and I was a theater director, and I traveled different countries in the world singing and acting and directing. And oftentimes I would use my art to address issues of the time. And found this issue of HIV/AIDS coming back into my life in my early 20s, and was living in California and continued to do, I would say, more deep tissue work, really collaborating with public health providers and HIV/AIDS advocates and people living with HIV/AIDS to create art. We would call it guerrilla theater, stuff that happens out on the street, at community centers, at playgrounds in different settings, using art to provide prevention education and urge people to know their status, to understand risk factors, et cetera. So really I had this thread that it was something about me the fact that I could lend my time and my talent. I have to kind of pause there because, you know, I really never thought about this as a profession. I know there are lots of CHWs who do this because of their heart and they're moved to
Mm-hmm.
back to their community. And so I didn't get paid for any of this type of work. It was just stuff that I did with friends who were other artists. You know, this is something we cared about, so it's something that we did. And then I had another really kind of shocking moment in my life years later. I'm in my 30s now. And, you know, I always stayed around community organizing and worked in nonprofits, but I was diagnosed with a really rare chronic disease. And for almost 10 years, I lived with that disease, and I didn't manage it well. I experienced a lot of racism and bias in the healthcare system. I ended up having to go outside of my state to get the care that I needed. You know, I was really blessed to meet someone that maybe a lot of CHWs know who do patient navigation, a man named Dr. Harold Freeman, who started doing some work up in Harlem early on to detect cancer among women, and eventually created the Patient Navigation Institute. And so I was a recipient of community health worker services and patient navigation services from CHWs to help me move from the place where I was, which was at times a life or death situation, to a place of wholeness and health, which is where I'm really blessed to be now.
Mm-hmm.
And so, you know, that there are layers in my life, from my mom to my own experience, to the personal loss, to the advocacy, to the art, that all help to inform why I have been a CHW for the last 15 years, why I love my community, and why I know that we are so valuable.
Wow. Now, this is why we just had a conversation just before we started recording. This is why I do the podcast, because you have told your story and how this work has impacted you. And so now, seeing the backstory that you receive the services through a patient navigator, and this is the way that you express yourself through art, and you know how much it means for people to have an outlet, and for those people on the receiving side to see the services that you put out there, and how it was healing, how it provided empowerment and encouragement. This makes me really excited to hear your story, and this is really why I do the podcast, so that people can share their story.
It's, you know, it's a joy really when I reflect on it, how many people have contributed to my life. I think everyone's life, and the way in which we are led or moved to give back.
Mm-hmm.
For me, this work of being a CHW is, it's the way that I show my love for my community.
Mm-hmm.
You know, like lots of CHWs, I've gone on to work in lots of different settings and or volunteer. You know, my church in Hartford had a health ministry, and I was able to lead that effort and run a food pantry out of the basement of our church for a couple of years. That's a way that I show my love through my faith, but through this this model of outreach and engagement and capacity building and education and connecting folks to services. You know, and the more that you do open yourself up to listen, I just think, like all of us, when people begin to unfold their stories, and you hear the need or the needs, because so often there are so many, whether they're needs of the heart or needs of finance or needs of education or support or guidance, or advocacy, motivation. You know, that's when you want to do more.
Mm-hmm.
So
Yeah, this is true.
yeah, I mean, I was thinking, like, I've worked with people living with HIV/AIDS, and I've worked with people who are trying to prevent a second heart attack or stroke. And, you know, I've worked with with husbands and wives who've experienced a fetal or infant death, and in some small way, you know, it's just an honor that people let you in, and that you can build trust and relationship for the time that you're together. And it's an honor to have someone say, you know, thank you, and this helped. You know, this is what I
Mm-hmm.
heard me. um, and like I said, because I've been a recipient of those services, like I know how precious that is, and I really honor this work.
So I know that you have an extensive resume. You have some amazing honors, and I know that you've been involved in a lot of work with health literacy, and that is a very important component when you're out there working in the community and you're providing resources and you're navigating people throughout the healthcare system and communities where they need these resources. So can you talk a little bit about your work in that area and how you started to get that ignited as you were kind of navigating through the different careers that you were going through?
Yeah, for sure. In those times when I was hired as a CHW in some of the kind of program work that I just mentioned, you know, all of those different chronic disease states or all those different situations, there's usually really complex clinical information. You know, the eligibility can be complex, the accessing services can be complex. And something that I like to do, because I think the world sometimes is just too complicated, is to take things that are complicated and try and make them simpler to understand.
Mm-hmm.
That really matters to me. I'm also the mom of 4 kids, and they're well, 3 of them are young adults now. All really different people, and so, you know, being able to take the same information and communicate to different folks in a way that they can understand it, that really matters to me, and I get a great sense of joy and kind of fulfillment out of that. So, you know, a couple of items I think I would just kind of highlight as real opportunities for me to support my peers, other CHWs, and to use this kind of focus around health literacy is when the state of Connecticut decided that they would launch their own marketplace. Um, a lot of folks remember when the ACA was passed in 2010. So many people had been fighting for folks increased access to health insurance or healthcare coverage through Medicaid. And so it was a joyous time, but a time of a lot of complication. A lot of CHWs around the country, and I met many of them, were all involved in getting people enrolled in Medicaid or through healthcare.gov or through their state-based marketplace. But if you talk to any of them, they will tell you how complicated this insurance jargon really is. For people who've never had health insurance, and there are a lot of people, disproportionately people of color. People of color are more likely to have a job that does not provide insurance than their white counterparts. And so when you're enrolling lots of new people for the first time, you can imagine how complicated it is. And then add that all the tax information, and then all the technology of using a portal and uploading documents. So it was my job to make those concepts and those processes easier for my peer CHWs so they could go around the state and enroll people. And it's a lot of back and forth, you know, a lot of it is as much listening as it is teaching, right? Because people, if you listen, they'll help you to understand the piece where they're really getting stuck. You know, here's what I really don't get. Yeah, I get this, but why? Or yeah, I get this, but how? Or yeah, I get this, but this is not working. I tried it and it doesn't work. So health literacy became like a real critical focus for me, and in particular, health insurance literacy, because if you cannot pay for your care, if you don't have health insurance coverage, if you don't receive it through some other benefit, like your employer or through Medicaid, how can you really achieve your best health? And so it becomes its own important portal or gateway to you achieving your own health goals. Of course, we want people to access prevention and healthy food and exercise and those things so that they don't end up in the doctor's office. But when they need to seek medical treatment or get their prescription filled, or, you know, God forbid, they end up in the hospital, like, these processes need to become simple. People need to know what's covered, what's not covered. Am I going to get a surprise medical bill? Who is in my, all these things, you know? And again, it was just amazing to work with all of my peers, because we were sharing information in 10 different languages in many different communities around our very small state of Connecticut, where we have like 95 different languages spoken.
Wow.
And folks really would come back and say, no, nope, not that. I need this. I don't need that. I need this. And so it was as much being responsive as it was like, you know, teaching folks.
You know, when I can relate, when I was working in the clinic and, you know, seeing patients all the time, I was just telling someone the other day, I said, you know, when we're all working together on a multidisciplinary team, everyone kind of has their focus or their lane, their specialty of the different things that they're focused on. And with insurance, it changes and it changes frequently. And sometimes depending on the population that you're working with, at that time I was working with seniors. And so it was hard for them to keep up with certain things. They may not have understood, you know, maybe they got something from their physician and then they went and they heard something else from from the insurance people. And so as me, as the CHW, you know, I was there to try to make things easier for them and for them to understand. But at the same time, we also ran into the issue of where other people were calling them and they were getting scammed and they didn't realize that. And so then they were, you know, choosing different things that they just didn't understand. And so I totally understand how important it is for CHWs to be in that loop and also have like a focus towards that, because it changes so often. It can kind of be hard for people to keep up with, but I know the value in how a CHW can make that transition easier as well.
You know
so
what?
I appreciate you talking about that.
First of all, I think you said it so well. And I think your comments are totally appropriate for the times that we're living in right now. You know, I had a call earlier today with doing a brief presentation for the CHW work group at the Centers for Disease Control. And a great opportunity to connect to so many different leaders who are concerned about many different chronic disease states, global health, et cetera. And a question came up and a conversation ensued about, you know, community spread in this pandemic of the coronavirus or COVID-19. And the question about communities' access to accurate information that they can understand, that's at the right literacy level, information that they can trust. And we are in a time during this pandemic where, because we're all learning about this virus, bits of information are coming out, and sometimes they're minor tweaks and changes. Sometimes there's significant tweaks or changes. At first, I think there was a sense from lots of communities of color, in particular Black communities, that, well, maybe we're kind of not getting it. Like we don't really see images of us getting it. Maybe it's kind of world travelers and folks doing business in big cities, and looks like it's folks that just traveled overseas. And now, much like HIV, we're acknowledging that this crosses all boundaries: economic, demographic, kind of every socioeconomic community that you can envision, and that all of us have to have these universal precautions and social distancing measures to stay healthy. Similar,
Mhm.
the information changes. It's like, well, you know, who do I trust? Where should I get my information? And I've heard from a lot of CHWs lately that, you know, their state or their municipality or their hospital might be pushing out information, but they're saying, let us be this bridge. Let us
Mhm.
be the translators. Let us bring the message to community because we have this trusting relationship. And we want
Mhm.
folks to get right now information that they need, especially as it continues to shift. So I feel like our role as CHWs is more important than ever.
Mhm. Thank you for bringing that up. That's a great segue because I was going to bring that up about the current state that we're in right now with COVID-19. And what are your thoughts about CHWs being integrated into the communities and spreading the awareness of COVID-19 and how to be safe and all of the different areas around health education for this pandemic?
Yeah, so, you know, as I said, I've been in this role for about 6 months, and no one could have, no one could have prepared me or told me that, you know, in a couple of months, you know, you're going to be fielding calls from around the country and around the world to begin talking about the role and the opportunity for community health workers, promotores, community health representatives, folks who are paid,
Mhm.
who are volunteer, to be so integral in terms of this COVID-19 emergency response. It's
Mhm.
really blown my mind, and it is only with the deep support of my advisory board and our members and our partners that we've been able to have a response and that we're growing in our capacity. Um, a couple things I want to say though, and I preface it by saying we are all learning. We do have to come through this together. The social distancing and other measures that are focused on public health are what's going to bring us through. We cannot, over medicalize or our way out of this because we don't have a treatment right now. And even we're kind of starving for testing in some places. We just don't have the resources and supplies. Um, I have found that as cities and states are standing up their emergency response efforts, emergency response teams, that CHWs are telling me across the country that they're not, the majority of them are not uh, a part of the team in terms of creating innovative solutions, um, identifying target communities, bringing back best practice information, data from the community to emergency response teams to adapt their approaches and strategies. I found that there is much opportunity for CHWs to be a part, but that hasn't yet materialized. Now, in some places it has. There are some employers where they've said to their CHWs, you know, you were providing this service, we're going to kind of shift your role, you know,
Mhm.
maybe staffing a 211 line. Or maybe you can work from home and connect to your clients or community members from a distance through some other telehealth or some other mechanism. But there are many other opportunities for CHWs who are bilingual, multilingual, to translate documents, to provide, I would say, to make sure that folks have a culturally and linguistic appropriate service, whether they're at a food pantry, whether they are trying to apply for unemployment, whether they are trying to find out where they can get screened or tested for COVID-19. You know, there are some cities that are trying to stand up additional shelters for their homeless community. They're trying to stand up new food pantries in communities that didn't have them before because there's a need. And in so many instances, CHWs may already be serving those individuals or communities or have deep knowledge of who really needs resources right now. And so I am excited for the time when we are seen as a profession, which is what we are, whether paid or unpaid. And I think that's different for people.
Mm-hmm.
Understand that we don't have to be paid to be professionals, right?
Mm-hmm.
But that we are valuable in our insight and experience and in our bridging of community, social and health and behavioral health services, that we can really lend leadership to this time.
I so agree. I totally agree. Especially when you talk about connecting people with services and them being able to relate to the individual that's doing the connecting. It's very, very important that, that CHWs have that opportunity to have those leadership roles, I believe, and organizing different initiatives within their community. And now is a time that I think the field can be utilized in that way. Food pantries, services, healthcare services, people getting connected that have children that need resources for their children, educational resources. There's so many different ways that CHWs can be utilized. And I, like you, I'm excited for the time and the conversations. I want to encourage our listeners, the CHWs that are listening, to continue to do the work. As I said before on the other podcast before this, is, just because many of us may now be working remotely, that doesn't mean that the service stops. Because once your community knows who you are and they know that you have connections to resources, they're still wanting to get those resources.
Yes.
And they're still going to reach out to you.
Yes.
So I definitely encourage everyone to still put out those resources, share them socially. If you have that email blast that you have for people in your community, or you're sharing it on social media, share it. You never know who needs that resource. You just never know.
Yeah, absolutely. I've found over this past month that our leadership, our creativity, innovation, our heart has really come forward, like through a lot of social media. CHWs are looking to support one another, of course, during this National Public Health Week.
Mm-hmm.
I know you're a part of this entire week of events that is put forward by CHWs and for CHWs. And I just love to see that leadership. This podcast is another vehicle where folks can connect. We'd love for you to connect with us through our website, NACHW.org. A lot of folks are connecting with me through LinkedIn or through Facebook. We have a lot to offer one another, a lot of support to offer one another during this time. But the phone is going to ring. So that if folks know how to reach you, they're going to continue, as you said, to reach out. And so we want CHWs to remember, like, your self-care regimen, or time of journaling, your time of meditation, your time of prayer, taking walks outside, connecting with nature, drinking lots of water, getting good sleep, connecting with loved ones in a way that you're not always giving, but that you're also receiving.
Oh, that's a good tip. That's a good one.
I mean, this is an exhausting time, with word not from my family checking on me, my husband cooking for me, my daughter, my sons, calling me, my mom. I have a network of people who understand what I'm doing, and I'm checking on them as well. We have to model who we are, right? We are community centered. And so I know social distancing makes it different. And I know folks are feeling that it's heavy. They're feeling that loss. They're feeling that disconnection. Open up your creativity, connect with other CHWs, ask them what they're doing, learn from folks, come to our site if we have sources that we can help you so that you can do what you love to do, right? Which is see people's health improve.
Definitely, definitely. So I know that you're super busy, especially in this time, like you said. you know, you have a lot going on, and you are jumping on calls and going to meetings, things like that. But what do you do for your self-care? You just mentioned it, but what are some things that you do to make sure that you stay in check with yourself?
Yeah, well, I'll tell you something that's just really concrete is like I listen to my daughter and I listen to my husband. They
Mm,
they have seen the change, you know. I work from home as many folks are working from home now. And when that day, you know, turns into night and I'm still working, they notice, you know, and my daughter will
mm,
kind of come and, are you done yet? And I thought you said at 5 o'clock, you know, 30, you know. And you can kind of say, yes, but I have this important work to do. Or you can say, yeah, you know, I said I was going to give myself that time. I said that I was going to stop so that I can begin to regenerate and recuperate from this huge day. So I'm choosing to listen. The other thing is that, you know, now it's springtime here in Connecticut. And even though it's like, can still be 20 something degrees in the morning,
mm,
if the sun is out, like I'm outside. I take breaks just to walk outside my door and really feel the sun on my face and actually breathe the fresh air. It's amazing what that does for me. I love the sun and I love nature. So even getting a little taste of that like really matters. And the
mhm,
drinking, you know, lots of water, and I have water beside me right now, and I tend to drink several cups a day or tea or something like that. But the other thing I started to notice is that I was taking away like music from my life. I wasn't playing
mm,
it, and I when I turn it on, like African drums real low when I'm working, or some sort of other instrumental music, it's just a soothing force for my body.
mm.
I'm still working through, I do find that I check my posture, and the music makes me want to relax a little bit more, and so it's helping. So I'm building, you know, I'm trying to
Mhm.
and seeing what works.
Well, thank you for sharing that because it is so important to do self care. I always ask that question because as community health workers out in the community, you're constantly giving, and it's also important to
Yeah.
take time for yourself, especially in such a
Yes.
time as this
Absolutely.
when things are a little bit, more hectic and you got a lot more things going on and you're trying to constantly serve, make sure that people have the resources that they need. And at the same time, hearing about everything that's going
Mhm.
on, whether that's media on the news, radio, and just being self-care and aware of your energy is really important, I believe.
Mhm. There's a wonderful graphic that it probably has come in different forms that people have shared, and you know, it kind of centers around one kind of centers around like, you know, who do you want to be, you know, during this time? You
Mm,
want to be someone who is responding, you know, solely based on fear? Do you want to be someone who's hoarding and terrified to connect with people? Do you want to be someone who's learning, who takes in information and then kind of steps back to really absorb it and understand it? You're someone who's learning from others and opening yourself up to change, because there's a lot of change happening. And I think if you're not flexible enough to consider, it might be that rigidity might be tough
mm,
in this new environment. And then it says, do you want to be someone who's growing? You know, what does grow from this? And when you talk about growth, you're talking about life, right? Things that don't grow are dying. And so
mhm,
how are you seeing growth? Are you making new connections that you want to last? Are you deciding to take up a new skill set? or have you found that you're really good at something that kind of wasn't cultivated before? So I think there are opportunities to see this time through lots of different lenses and to kind of walk around this challenge and find out how it's changing you, because we are changing, you know, through our entire life, from last year to 5 years ago to 10 years ago and into our future. We will carry some things throughout, and other things we will let go because they're just not necessary right now. The last thing is just this issue of control. Like, someone did share with me a great graphic, and it had a circle inside of a square, and inside the circle it just said, these are the things that I can control. You know, I can control. I'm gonna come off social media or turn off the news when I am aware that my body and my mind is tense, that it's overwhelming, that my eyes are tired from staring at the screen, you know, that I'm no longer learning. It's just kind of hitting me. So there are things that we can control, to still be kind, to look for opportunities to check in on folks during the weekend, as well as being kind to ourselves. And then the stuff that we can't control, which is so many things. It's so very many things. And making peace with that may help us see better the things that we can control. It may help us reach out to folks who are in that sphere of influence and control. And that might be an important connection that we make. And then really to trust. And I always go back to, of course, my personal faith. You know, I believe that I'm here, and I believe that I have work to do, and I believe that God is for me. You know, I believe that I'm learning, and that I'm here to learn, that I'm not perfect, nor am I becoming perfect, but I'm becoming changed. I'm learning and I'm growing. And I give myself that permission to make those mistakes and to be in the process of learning and growing with other people. So I do hope that good things come out of this time. And of course, my prayers are with everyone who has experienced loss, because there is real loss, whether it's a job or a family member or a meaningful connection. You know, we will get through this, as many have said, but we have to keep holding one another up. And I think your podcast continues to do that.
Well, I appreciate that. I love how you talked about growth, because this is a time where we all are growing, and it's a time to be innovative. It's a time to shift and just navigate, you know, what works, finding out what works, what doesn't work, and learning from it. You know, we can always learn from everything that happens. That's my personal belief.
Yes.
Try your best to make lemonade out of it.
Yeah.
You know, and you just kind of navigate and try to find your way. And as you were speaking about growth, it made me think about your journey. And so you are a Robert Wood Johnson Culture of Health leader and a Universal Healthcare Foundation Leaders in Action Fellow. And so as CHWs are thinking about how they can grow and how they can best move their career forward, you know, can you share with some of the CHWs ways that you did that throughout your journey? And when you saw those opportunities, what are some things that you did?
Yeah. You know, I think the foundation of those and both of those programs have been so worthwhile to me. Out of these programs have come mentors, informational learning, and also friends. And I think the foundation is to kind of know your own worth. You know, I used to start when I would go to do some sort of public speaking, or even if I would start a group session or something, you know, oftentimes they think it's the expert who's going to stand up and talk. And so to kind of break the ice a little bit, I would get up and I would say, "Hi, my name is Denise Octavia Smith, and I'm nobody." At me in this odd way, you know? And I said, you know, I just want to reset your expectation, you know, because I think this is all going to go one way, where I'm just going to be banking, you know, kind of pushing all this information to you. And your job is to, you know, validate that I'm the smartest person in the room. And that has never been the case.
Mhm.
By the same token, I recognize, and I want all CHWs to recognize that, like, whatever table you are at, whether it's a coalition meeting or you're with an integrated care team or whatever it is that you're doing, you're working on legislation, you're trying to get services expanded in your community, whatever it is, your perspective as a CHW, your thoughts about this thing, your questions are going to be unique. And I've learned to kind of be in a space and put myself in a space because I wanted to learn, because also I know that at some point I was going to have something meaningful to contribute. And oftentimes I wouldn't know what it was. So the Universal Healthcare Foundation, they in Connecticut, they helped to support our first open enrollment. So this is back in 2013. And obviously we're instrumental in making sure that our state was expanding Medicaid to folks and that our marketplace worked. And I couldn't believe that. I was like, I'm a leader. Like, I'm a leader in what? It was just kind of, and I thought, first of all, I'm happy to come to a meeting because I love being around folks and I love learning, but I'm not sure, like, on the contribution side, what do I have to contribute? But as they asked me to write, in my writing, I just started to, like, hear my voice around the issue of coverage. Not that I was the smartest person about Medicaid eligibility and all of those requirements or even how to structure everything, but there was something that I had to say that that was different. And it's similar to this RWJ Culture of Health program. First of all, when I first came to be an ED for NACHW, I think maybe a month or 2 months after, RWJ released the application. And a number of CHWs who saw that in my signature line reached out to me and they said, I was thinking about applying. And I said, absolutely apply. To every single person who emailed me with an interest, I said, apply. And if you don't get it this year, apply the next year. Because the questions that RWJ was asking about our vision for a culture of health, these are the kinds of things that I think CHWs dream about, but in our roles, we don't often get an opportunity to, like, really flesh out. You know what I'm saying? How many?
I'm just shaking my head as you're.
You know what I
mean?
mean?
You're saying this, I'm just shaking my head.
So, like, I thought, you're kidding me. Like, you're asking me without constraint of resource. You just asking me, what is my vision? Like, what does it look like for people to have the agency to transform the systems that are supposed to serve them, to bring forward and center equity, diversity, and inclusion, to flip this whole issue of governance, that communities, have that sort of authority and governance over these systems that are funded by our tax dollars, that are supposed to make us healthier. I thought, yeah, I definitely want to think about that. And I definitely think about that. And everything else comes, like, when you are in that process of learning and discovery, when you're brave and you go to that meeting, and you're taking your notes and you realize something hasn't been said, and you're like, man, no one's talking about this, The question is, will you say it? Do you value yourself? Do you value your perspective? And, has the voice of your community come forward? And I think we need to be brave and of course, support one another in that time. But these two organizations, Universal Healthcare and Robert Wood Johnson, they're providing different spaces, different opportunities to do that. And of course, there are competitive processes and that kind of thing, but there's stuff in your local area. There are leadership, opportunities that offer scholarships. And sometimes we just never apply, because we don't see ourselves as present leaders or as future leaders.
Yes. I mean, I literally am just here shaking my head because when I began to step out more and become more vocal, I did have some of my peers come and ask, how I did certain things, and I would share, and I still do share whenever there's opportunities to serve on the CHW advisory committee for the state of Texas, or even at work in a capacity for a committee, I always tell my colleagues to apply, to do it. You're not
Yes.
going to know everything in the beginning. I
Yes.
mean, you're just not. You're going to learn along the way, and that's the beauty. And it can be intimidating in some ways because it's like, well, I don't know this or I don't know that, but you have to go back to what you just said and remember that you do have a voice and you are speaking and sharing those concerns and all that experience with those individuals so that things can be in place for the community that you are serving. And when
Yeah.
I tap back into that, that's when I get more bold and I get, I have that just go get them attitude that, it's never about me. It's always for other people and to highlight other people
Yes.
and thinking about that community. So thank you so much for saying that. That was so good. That will probably
Oh,
be the clip.
listen.
Because that was so
Yeah.
good. It's like,
Yeah,
it's all about
I want to
empowerment.
see us, I want to see us everywhere. I want to
Mhm.
see us moving in up. We already are touching every sector, but we're not as we started out earlier, we're not often leaders or seen as leaders, being brought forward and asked for our perspective. And sometimes we do have to advocate for our
Mhm.
for our profession, for our community. And, that can be uncomfortable sometimes and it can make folks uncomfortable sometimes. Um, I hope that NACHW can continue to cultivate leadership. We have an amazing ambassador program of 20
Mhm.
ambassadors in 19 states. And these are folks who probably they're CHWs, maybe they didn't necessarily brand themselves as leaders, but they are in that they're willing to reach back to their peers. They're considering their own work and the work of others in a larger context. They're stepping back to reflect. They're reflecting on this national organization and giving us insight into how to make it better. They are leaders and we need their voices just like we need the voices of our members and your organization. If you're working somewhere, if you're volunteering somewhere, if you see an opportunity like Tasha said, you should absolutely go for it and know that you can do your part, right? You can contribute the piece that is unique to who you are and authentic to who you are.
So recently, I saw the post that you had shared, and it says the U.S. Department of Homeland Security identifies CHWs as essential critical infrastructure workers to help COVID-19. And so I wanted to ask you, um, as moving forward with the National Association of Community Health Workers, and now seeing this article come out, it really gave me a boost. I saw a lot of my colleagues comment and like it. It makes the field excited to see that we're recognized. But what is to come with NACHW, and how did that make you feel once you saw that come out?
Wow. Honestly, it was surprising and a little delightful to see that the Department of Homeland Security, that CHWs had a champion somewhere who elevated the workforce to this place where it ended up in this March 19th memorandum.
Mm-hmm.
A number of states have adopted this exact language into some of their kind of critical, essential workers, essential services listing, as lots of businesses and other things are being closed down and states are trying to figure out what's safe and what's needed. To get that guidance and to have us included was really, it signaled a shift. And so we are having impact at the highest levels. That doesn't mean that everything is well articulated in terms of our unique roles and our qualities and our skill set. I know there's lots of learning still to be done, but I was really, really encouraged. Um, you know, the ability of NACHW to get that word out and to build upon that, to share that nationally, to share it with members, so that they can advocate for themselves at their local and state level, to share it with other national organizations, to say, we are having impact and we have relevance in many different contexts, and considering an essential critical workforce during this time, and to know that our skill set, our competencies, our qualities of compassion and trust and respect and dignity are crucial during this emergency response. Wow, it meant a great deal to me. I think it's a milestone.
I do as well, and I was happy to see CHWs definitely included. I'm excited to see just and hear about different initiatives that CHWs will continue to be engaged in. And so I know NACHW is doing a lot of work with moving CHWs forward in the workforce. You guys are doing some amazing work so far, and I love seeing the ambassadors out and giving the communication about the association and just moving the field forward. My ambassador for the state of Texas is Delantria Williams, so I want to give her a shout out.
Yeah.
And I'm very appreciative of the work that's being done and your leadership and guidance, as well as the board, and everyone is moving the workforce forward. So I definitely want to give you guys a shout out and just appreciate for years the work that everyone has played, the roles that everyone has played, because I know it's been a long time coming. It's been a long time coming.
Yeah, as I was talking about the value of your podcast, that's one of the reasons that I wanted the newsletter, is to be able to say, folks need to be able to connect with their ambassadors and hear about the great work that they're doing, and connect with them. So, I encourage folks, if you're not a member and you don't get the newsletter, you can go to the website and you can look up your ambassador. We don't have an ambassador in every state. We're kind of not there yet, but I know folks are asking, like, how can I become an ambassador? And so one, you can connect with one of the 20 ambassadors. Their contact information is on the webpage. You can read their bios, read a little bit about what they're doing, and if they're in your state, make meaningful connections. And also, we have an annual meeting coming up in August. We had already disclosed the dates, and then with this pandemic, the question really is, will we have it in person or will it be some sort of virtual meeting? But you're going to be hearing from our ambassadors at that annual meeting, at least some. Those who are ready to share the great work that they've been doing, leading their CHW networks or associations, or providing service in one of many different sectors and innovating. So we want to lift up them as the next generation, of leaders, and we want to encourage folks to connect with them. And then for everybody listening, if you have something to share in your local community from your perspective as a CHW, a promotora, a CHR, a lay health minister, a community health connector, a peer, an outreach worker, we want to hear from you as well. And you can always go to our website, to the Connect page, and you can upload information about one of your events. You can share with us an article or a resource that you think is valuable to other CHWs. Maybe it's a report from the work that you've been doing or anything like that that you feel can benefit the larger community that NACHW can get out. And even folks who are looking to hire CHWs, they can also upload job descriptions. We've had announcements for research and for job descriptions there. So we're trying to make NACHW something that everyone can find a connection to, that it can be valuable to folks in different ways at different times.
Thank you so much for your time. I really appreciate you sharing all of the nuggets with everybody and for being a champion for CHW.
Tasha, thank you for inviting me. I had a chance to listen to a couple of the podcasts. And I just, first of all, I'm grateful for the work of all the CHWs that you've lifted up. And again, I just want to thank you for this platform. I think it's wonderful. And we'll continue to share that the podcast is available to CHWs. And just thank you for lifting up NACHW and for your deep support.